Crime and violence are everywhere, in the news, movies, on social media, in workplaces, schools, and even our own homes. Last year, U.S. homicides jumped 25% after decades of downward progress. When violence results in physical injury or death, the link to health is quite obvious. But violence doesn't just affect direct victims. It's also tied to negative health outcomes for perpetrators, witnesses, their families, communities, and society at large. Here's how. Violence affects mental health. Multiple studies have drawn links between violence and an increase in mental health conditions. The trauma caused by domestic violence is associated with high rates of depression, anxiety, PTSD, self-harm, and suicidal ideation. Violence impedes physical activity. Concerns about neighborhood crime can keep people inside, increasing the risk of obesity and diseases associated with sedentary behavior. For example, parents may not let their children play outside or walk to school out of concern for their safety. Violence is a risk factor for chronic disease. Lifetime exposure to violence is associated with higher rates of chronic illness and infectious disease. These individuals are also more likely to engage in risky behaviors that lead to poor health outcomes, like smoking and substance abuse. Violence also places a huge economic toll on society. The CDC estimates that each year, over 2.3 million people are treated in hospitals for violent injuries, with costs totaling more than $85 billion. Violence comes in many forms, but each takes a toll on the health of our country. Learn more about the relationship between violence and health at MI Blues Perspectives /Crime and Violence.